My name is Lindsay Cartier, and I'm going to be completing my health assessment. This is my helper today. Her name is Heather. So we're going to start. How are you today, Heather?
I'm good. How are you?
I'm well. So today we're going to do a complete head-to-toe health assessment on you, okay?
Okay.
So first off, I'm going to ask you, are you having any pain today?
No.
No. Good. How tall are you?
5'2", 136.
Beautiful. I'm going to go ahead and start off by taking your blood pressure and a full set of vitals.
Okay.
I don't have a blood pressure cuff, so we're going to use the kitchen towel. Beautiful. So I would pump it up to about 150. Good. How does your blood pressure normally run? Not really sure.
No.
Well, good. Your blood pressure today is 118/70. All right, and now I'm going to check your pulse. Good. Your pulse is 64, and you're breathing 14 times a minute. All right, I'm just going to take a general look here at your skin. It's warm, dry. Any problems with your skin here on your arms at all?
No.
Good. I'm just going to take a peek at your fingers. Good. Good capillary refill. Beautiful. All right, so now I'm just going to take a look at your head. Head normal. Any pain?
No.
Tenderness with your hair?
No.
Any issues with your head at all?
No.
Beautiful. All right, so the first thing I'm going to have you do is I want you to turn your head towards my hand. Good, and then I'm going to have you do it on this side. Beautiful. Now push down on my hand. Good, and push back on my hand. Beautiful. Any tenderness with your head at all?
No, ma'am.
Good. All right. So next thing I'm going to do is I'm just going to go ahead and palpate here your temporal artery. Then I want you to go ahead and open and close your mouth for me. Any pain at all?
No.
Good. Now I'm just going to palpate your sinuses. Any tenderness with your sinuses at all?
No.
Very good. Just going to check your lymph nodes. Good. Any difficulty swallowing?
No, ma'am.
Good. Just going to take a peek at your ears. Any tenderness in your ears at all?
No.
Good. Thank you. All right. So what I want you to do for me is I want you to plug your left ear, and I'm going to whisper 2 words to you, and I would like for you to repeat them for me, okay?
Okay. Dog blanket.
Good. And now I'm going to go ahead and we're going to do it on this side.
Ocean sunshine.
Good. No ringing in the ears or tenderness at all?
No.
Good. Okay. Now what I'm going to do is I'm going to go ahead and have a look in your eyes. I'm going to have to shine the light in there at first, okay? So, any difficulty seeing at all? Do you wear glasses sometimes to dry?
Sometimes, yes.
All right. So go ahead and just keep your eyes straight for me. Good. Beautiful. All right. So now I just want you to take a look at the pen light for me. Okay. So now I'm just going to go ahead and keep your eyes on the pen light, and I'm going to bring it towards you. And back away. Good. Just testing all of your cranial nerves.
Okay.
Now I want you to just keep an eye on the pen. We're going to check the ocular motion, okay?
Okay.
Just follow it with your eyes. Very good. Good. Any difficulty seeing?
No.
Good. All right, now I'm just going to take a look at your nose. Any tenderness with your nose at all? Swelling?
No.
Drippy nose at all?
No.
Good. So the next thing I'm going to do is I'm going to check out your oral mucosa. Just going to look in your eye, in your mouth, excuse me. So first, just want to open up nice and wide. Good, good uvula. I'm just going to check out the sides, issues with your teeth. And can you stick out your tongue for me? Good. And tongue to the left, tongue to the right, up and down. Good. So good motion of the tongue. Just go ahead and lift it up for me. Beautiful. Any difficulty eating, losing sense and taste at all?
No.
Good. Okay. So the final thing that I'm going to do that has to do with me touching your face at all is I'm just going to take a look at your eyebrows. That's the last thing I just need to do. Just go ahead and lift your eyebrows up for me. Good. Beautiful. Good job. All right. So now we're just going to move down to your head and neck area. Any pain in your head or neck?
No.
No? Good. No tenderness in your lymph nodes at all?
No.
Good. All right. Can you turn your, tilt your head down to my hand? Good. And to this side? Good. Back? Good. And forward. No pain at all?
No.
Good. I'm just going to palpate your carotid. Very good. I'm just going to take a listen. I'm going to use the bell of my stethoscope. Good. You have good blood flow. We don't hear any kind of swooshing, which would indicate something that was negative. I'm just going to look at your trachea. Nice and midline. I'm going to have you take a sip of water for me. Just going to inspect your thyroid. Good. All right, so the next thing I'm going to do is I'm going to go ahead and just put my hands on your shoulders.
Okay.
And I want you to shrug your shoulders up and back down. Good. Just checking for symmetry one more time. Very good. Excellent. So now what I'm going to do is I'm going to go ahead and move down. I'm going to listen to your lungs. Do you have any difficulty breathing? No? No? Any chronic coughing? No? Good. All right. I'm just going to give you a listen here. Good. Your lung sounds are quite well. What I'm going to have you do now for me, please, is I'm going to scoot this stool over here, and I'm going to have you sit with your back facing for me, please. All right, so a couple of things we're going to do here. I'm just going to go ahead and inspect. Thoracic cage looks good. So what I'm going to have you do is I'm going to listen, and then I'm going to ask you to say 99 for me, okay? Okay, now if you go ahead and say 99.
99.
Again.
99.
Again.
99.
One more time.
99.
And again.
99.
And again.
99.
Very good. I'm going to do the exact same thing, but this time I'm just going to palpate with my hands. So go ahead and say 99.
99.
Again.
99.
One more time.
99.
And one more.
99.
Keep saying one more, and there's always one more, right?
Yep.
Okay, so no tenderness, no lumps.
No.
Very good. Okay, you go ahead and have a seat over there for me, please. All right, so now Excellent, sounds great. Now I'm just going to listen for a murmur. I'm going to use the bell of my stethoscope. Excellent. Any history of heart disease or heart problems in your family at all?
My dad.
Good. So something we got to keep an eye on, but your heart sounds look good and sound good. No pulsations, no heaves. Now I'm just going to ask you to go ahead and lie down for me. So the first thing we're going to do is we're going to check for a jugular vein distension. Can you go ahead and move your head to the left? Good. And to the right? Excellent. Now I'm going to go ahead and I'm going to inspect your abdomen. Any problems going to the bathroom?
No.
Good. So abdomen looks good. I'm going to go ahead and listen to your vowel sounds. Excellent. You having regular bowel movements, Heather?
I am.
Good. Now I'm just going to come up percuss your abdomen. Again, no tenderness or pain there?
No.
Good. I'm going to percuss over the liver. Any tenderness in the liver?
No.
I'm just going to palpate the liver. Just light palpation over the abdomen. Still no tenderness, no pain?
No.
Good. I'm going to palpate a little deeper. Still no pain?
No.
Examine the spleen. Excellent. Just going to record my findings real fast. Excellent. Just going to go on ahead and just check pulses, no grills. Those are your femoral pulses. Sorry.
No, it's okay.
Any pain down here? Any tenderness?
No.
Good. Well, I got you lying in this position. I'm going to go on ahead and just check the strength of your legs. Can you go ahead and push up on my left hand? Good. And push down? Excellent. Again? And one more time. Okay. Can you push down on my hands like you're driving? Good. And pull them up towards your head. Excellent. Push down? Good. And pull them up. Again, I think just easier for viewing, I'm going to leave her lying down and I'm going to check her pulses. Excellent. Any pain or tenderness in your legs at all?
No, ma'am.
Okay, I'm going to go ahead and have you sit up for me. Now we're just going to test some strength in all of your extremities, okay?
Okay.
So go ahead and put your arms out and push down. Good. And pull up. Good. And push down and pull up. Now take my hand, pull it towards you, and push it away. Excellent. Pull it towards you and push it away. Any pain in any of that? No? Good. Now I want you to go ahead and take your heel of your right foot and go down your left shin for me. And now do the opposite way. Any pain or tenderness when you do that? Excellent. Okay. So we're going to go on ahead and we're just going to check some sensation. All right, so I want you to tell me what you feel, okay? So go ahead and close your eyes. Stop. Good. Sharp. Good. Stop. Good. Stop. Sharp. Good. And then last one. Sharp. Good. Excellent. And again, capillary feel good on the feet. Just want to ensure that. All right, so the next thing I want you to do is I want you to take your hands and put them out to your sides. And I want you to touch your nose. You can go as fast as. Excellent. Any pain?
No.
Good. Go ahead and rest your arms out at your side. The next thing I'm going to check is your deep tendon reflexes. I don't have a reflex hammer, so we're going to use my stethoscope.
Okay.
Good. So this one kind of sometimes hurts a little. Sorry. A little twitch of that little hand. Good. Good. And the knee. Move a little, don't worry. You can see it. I'm going to do the Achilles. Excellent. Beautiful. Okay, so the last test I'm going to do for you is I'm just going to go ahead and ask you to stand up. And I want you to go on ahead and walk across the floor on your tiptoes for me. Good. And again on your heels. Good. And now I want you to walk heel to toe for me. Excellent. All right, so I want you to go ahead and put your hands on your hips and bend down at your knees. Excellent. And then bend forward and try to touch your toes. Any pain?
No.
Good. And while I was doing that, I was just looking at the spine one more time just to double ensure. Good. No problems with your back?
No.
Excellent. So I believe we have kind of gone over everything. You look great. You have any questions?
No, ma'am.
Okay, we would recommend you follow up with your provider